Thank you. Hello, everyone. Good afternoon. I guess we start with the technical messages from Eva on how to use this webinar. Eva?
Sure. Hi, everybody. Sandra and Yann will be presenting first, and then we will hold questions until after the presentation, at which stage you will be able to either chat your questions in the chat box, or you will be able to raise your hand, use the raise hand function, and then we will be able to hear you speak your question. So you'll see that functionality ready after the presentation. Please don't hesitate. I'll be monitoring the chat as well. So if you have any technical questions, please don't hesitate to chat them to us. Thank you.
Thank you. Thank you very much, Eva. So I'm Yann, Chief Executive of EURORDIS, and I'm very pleased to welcome you for this webinar. In fact, we're quite excited because that's the moment where we're going to share with you all the detailed results of the Rare Barometer survey on the impact of COVID on the daily life of people living with rare diseases. We're proud to say that more than 8,500 people have answered to this survey. And this is the first time we have so many countries participating. In fact, 89 countries around the world, obviously with high variation from one country to another, particularly outside Europe. But 27 EU member states have participated. I'd like to thank particularly here the members of EURORDIS who have participated early on in the elaboration of the survey, and particularly who participated in the webinar that helped us to identify the issues and build the questionnaire. We started very early on at the beginning of the epidemic, and all the fieldwork was performed during the containment period in Europe, with the variation we know, like Sweden and Germany having a different strategy, for instance, than Spain, Italy, or France. But also around the world, beyond Europe, this is different. It's not always under containment measures. It has varied a lot. So we have to be careful about this initial element. Many of you are, in fact, already using the results from the first presentation of the initial results. And I thank you for that. We know that several countries in Europe are very active in using it, for instance, in Spain, but also in the world. And just to mention two, New Zealand and Argentina, thank you very much for building on this data. And that's great, because that's exactly what we want to promote, advocacy based on evidence. And that's really what is the goal of this survey, is that there is what we know from our experience, from the members, from the people we know, but there is the reality of the experience of the patients or the families going through this epidemic. And this is what the survey is about, is to identify precisely the experience, but also the perceptions and expectations, and to bring that to the surface and consolidate it and be able to compare across countries and across therapeutic areas, or different type of situations that we want to compare and analyze. The first results have been presented at the European Conference on Rare Diseases by Sandra Courbier. Sandra Courbier is our Director of Social Research at EURORDIS, and there has been 2 sessions at the European Conference on Rare Diseases to present the social related aspects and also the aspects on interruption of care from the patient point of view. After that, the results have been presented in a webinar organized by the European Commission with the clinicians of the European Reference Networks. And in this webinar, there were over 80 clinicians from ERNs who participated and where results were presented, comparing also the different therapeutic areas. There has been also a presentation to the members, to the companies who are the members of Roundtable of Company, as we have a dialogue with them to understand the impact for them on clinical trials, on shortages, and other relevant issues like inclusion of rare disease patients in some of their trials. And last, there has been also a presentation to the EU Health Network, and that's important because we will pursue that work with the DG Health and the EU Health Network, so the European Funds Network and eHealth, on the aspects of teleconsultations and different elements that came out of this survey, which are very informative. So today, The objective of this webinar is that Sandra Courbier will present you a more detailed analysis and the lessons learned from the COVID survey. We want to focus particularly with the survey and the presentation on best practices, tools, and governmental measures that have been helpful for patients during the coronavirus epidemic, which is not over. And this will be useful to prepare for a potential second wave, third wave, whatever, or the next epidemic. But now that's the goal, is not only to observe what has happened, what was feared, what were the fears or expectations, but it's to prepare now, and to prepare based on the feedback of actual experience. All results will be available to our members, so do not hesitate to come back to Sandra and to the Barometer team to ask the results for your country, for your group of diseases, or even for your specific disease if we have enough answers. Last point, I want to tell you how we are already using these results. They have been included first in a position paper, in a press release, and the initial results disseminated, also through newsletter, website, etc. Then we had a position paper released recently on the impact of COVID on the daily life of people living with rare diseases and measures to consider while the containment measures themselves are being lifted. So to have an inclusive approach in the response to the post-containment period, to be inclusive of people living with rare diseases in the different aspects of their lives, so the care, but also the impairments and disability aspect, work, school, etc. The next use, and also, sorry, this paper will be particularly targeted and is already targeted to key people in the European Commission, but also to the permanent representation in Brussels of the EU member states, so to the health attaché. So I really encourage the national alliances who have not done it yet to send this paper, maybe with a translation, maybe with a summary in your own language, whatever you think the appropriate way, but to share it with your Ministry of Health and other relevant decision makers, to share it with your centers of expertise locally, to try really to make use of this new knowledge. Rare Disease International is also developing a position paper using these survey results and also using feedback of other surveys performed in Canada, in South Africa, and in Australia, if I am correct. And there is also two contributions, one by EURORDIS and one by Rare Disease International, to a public consultation of WHO on COVID, so that be sure that the results of the survey are also being used in that sense. In the chat, Sandra has now shared with you the link to connect with the colleagues of the Barometer team. Thank you very much. And now I hand over to Sandra to get into the real stuff.
So good afternoon, everyone, and thank you very much for joining this webinar. So I will share my screen. I hope you can see my slide. Is it okay?
Yes.
Okay. So as as Yann said, the idea today is to really focus on the lesson learned really from this survey, and what was the measures and the tools that have contributed to help people living with a rare disease during the COVID-19 pandemic, even though it's not finished, and it obviously depends on countries, but this will help us to prepare for future crises that might come. So just a reminder about the main feature of the survey. So the survey was disseminated during the confinement period in Europe from 18 April to 31st of May. We gathered 8,551 respondents, which comprise rare disease patients and also their family members. So it's an online quantitative survey that was disseminated through social media and through the EURORDIS Patient Organization Network. The survey was translated in 23 languages, meaning the most used languages in Europe. So as Yann said, 89 countries are represented in the sample, and they are reparted as follows. So as you can see, we have a very good participation in Europe, and in particular in Western Europe, with more than 1,100 participants in France, 800 in Germany, almost 800 in Italy, 700 in Spain, and we also have a very good participation in Eastern European countries, also in Scandinavian countries. And for this survey, this is definitely the first time that we have also wide participation of countries internationally. I'm thinking in particular about South Africa, with more than 300 respondents, the US, 132, Argentina, where they have already started to use the result 93, 81 in New Zealand, 69 in Chile, 69 in Russia, 59 in Colombia, 48 in Australia, 46 in Ecuador. I can't really mention everyone, and but thank you very much to all those who participated, and this is great to have all this data that enables so many different analyses and in-depth comparisons. In terms of repartition, depending on the disease area, for this survey, we had a very good representation of rare pulmonary diseases, thanks in particular to the mobilization of cystic fibrosis networks and also pulmonary hypertension. We also have a lot of respondents for rare malformation and developmental anomalies. I'm not going to name all of them, but basically we have a significant amount of patients in almost all of the disease area, which is great also to enable comparison and more detailed analysis. We have some diseases that are also very well represented in the sample. So as I said, we have more than 800 respondents for cystic fibrosis, almost 200 for Ehlers-Danlos, 112 for systemic sclerosis. So, but in total, we have 1,366 diseases represented. So, as it is for the rare disease population in general, you have a lot of respondents for some more prevalent disease, and for many diseases you have one or two respondents across the world, and this is very aligned with the description of the rare disease population that has been done, for example, in the most recent Orphanet paper. So in terms of results, as I said, the survey was disseminated during the confinement period. So this is, I'm presenting now really the results on the 8,500, so the overall sample. So in 94% of the countries, there was a closure of educational facilities in place, social distancing in 99% of the countries. In 85%, patients reported that lockdown measures were in place. And then we also asked about something that has been implemented quite largely in Europe, actually. That was exception regarding containment measures for people living with intellectual disabilities and their caregivers. So these measures were implemented in quite a lot of countries. I'm going to show you the data in more detail afterwards. But it's interesting to see that many people didn't know. So on this measure, this is maybe something that on which we could maybe provide more information, and maybe not all the people knew that this was actually in place in their country. But what was very interesting to see in the result is that where these measures have been implemented, it definitely had a positive impact on carers and on mental health indicators. So where people were aware of these measures, -6 have felt unhappy or depressed compared to other countries. -7 have felt that they could not overcome their problem compared to countries where it wasn't implemented. And -9 have felt isolated. So I think this was an important finding of the survey to explore this positive impact of this exception for people living with intellectual disabilities. Overall, it's also very interesting to see that the level of anxiety, weariness for respondents were extremely high. And one of the objectives of this question was definitely to compare with the general population. And so you have approximately 70 to 80% of people who are worried for themselves or for their loved ones. Like 73% think that the coronavirus poses a very high threat or high threat in their country, for example. And what was very interesting to see is that it's very comparable to what we can observe within the general population. And something that was clearly mentioned by our patient organization network was that within the pandemic, people living with a rare disease and the general population were feeling the same feeling, and the situation that people living with the rare disease are experiencing, like lacking information about their disease, living in the unknown, and so on, was somehow experienced by the general population. And the perceived threat by country varies quite a lot by country. So as you can see, for example, the perceived threat is average in France, for example, so 72%. But for example, in Spain, the perceived threat was a little bit higher, 81%. And in Scandinavian country, the threat was perceived as lower, especially in Sweden, where lockdown measures weren't in place, so 54%, for example. And also internationally, what we can say is that in South American countries, the threat was perceived as very high. So 94% in Chile, 90% in Brazil, 88% in Colombia. And as compared to what happened in South America, we can see that in English-speaking country internationally, the perceived level of threat was definitely lower. 56 in Canada, 53 in Australia, and 48 in the US. So I've put some stars when actually the number of respondents is a bit low and when results has to be taken with cautious. But definitely we can see a lot of variation across countries. Then in this survey, and this is the first time that we are showing this result, we can see that very few respondents actually, so it's the respondents, it's not the population, the real population, but still I think it's a very good indicators to see that very few people living with rare disease have been tested for COVID-19. So only 5 have been tested for COVID-19 within the respondents. And so 57% haven't been tested, but weren't considered as necessary, but 36%, so almost 1 in 4, weren't tested, but thought that they should have been tested. So I think definitely there were some unfulfilled expectations regarding the number of tests that were carried out. And this expectation, again, vary according to countries. So there was a higher expectation in France, for example, with 58% who haven't been tested and who have liked to be tested. In Spain, 57%, Italy 56%, and Romania 50%. And in some countries, there were lower expectations. So in South Africa, 15%, Germany, 19%, and Portugal, Poland, 20%. So this is something that we need to be discussed a little bit further, and this is of course specific logic for each country. Sometimes, of course, when you have a healthcare system that is functioning very well, it makes expectation higher, or it can be also due to the debate that was happening in the respective countries. But still, I think this definitely can have an impact also on the perception of how the respective government have handled the crisis, and the differences are interesting. So we can see, sorry, that's the same. We ask for those who have been tested if the result of the test were positive or negative. And again, in the sample, we have very few. So it's the numbers, not the percentages, because the numbers were too low. But as you can see, only 45 respondents have seen that they have been tested positively for COVID-19. So it's very few patients at the time when we carried out the survey. Also, very few patients have been hospitalized for COVID-19. So only 40 have been hospitalized in a normal ward for COVID-19 patient, 10 in intensive care without intubation, and 11 in intensive care with intubation. So of course, the numbers are very low, but what was interesting is that expectation regarding the inclusions of families, the possibility when patients were admitted in hospital to be allowed to help with this admission and so on, was not completely fulfilled, because 20 of the respondents among the 61 say that it would have been better if they had been included. So then something that hasn't been also presented so far, and on which we have started to work, is the analysis of the open questions. So in the survey, we had a question about, so if you have any specific experience in relation to the care received for the rare disease since the pandemic started that you would like to share with us, please relate this experience in the section below. And for the purpose of this webinar, and in order to identify best practices, tools, and measures that were helpful for patients, we have explored more in depth the positive experience of patients. And so we haven't analyzed completely the responses. So I have a little codification that I'm going to explain. So we will show you the verbatims, and when you have 4+, it means that more than 200 of the respondents have specified this spontaneously. 3 stars, 3 cross is more than 100, 2 is more than 50, and 1 is less than 50. So just first of all, a little reminder about some figures that we already presented, just to contextualize a little bit the answer of the respondents. So as we showed in the past, 9 in 10 have experienced interruption of the care they receive for their rare disease during the COVID-19 pandemic. And so 6 in 10 who had diagnosis test plan have seen this diagnosis test cancelled or postponed. 7 in 10 have seen their appointments with GPs or specialists with provide care for the rare disease cancelled or postponed. More than 5 in 10 who had surgery or transplant planned have seen this interruption cancelled or postponed, and 6 in 10 have seen their psychiatry follow-up interrupted. So as you can see, the detrimental and collateral impact for people living with rare disease during the pandemic was extremely strong, and was definitely reinforcing difficulties that people living with rare disease are already experiencing in their daily life. This interruption of care weren't at the same level in the different countries. So 57, this is the figure that I presented earlier, have seen their medical therapies at home or at the hospital postponed or cancelled, but it definitely varies across country. So it was 46% who have seen these medical therapies cancelled in France, but it's much more in countries in Southern Europe. So 70% in Spain, 68% in Italy. Also, in Scandinavian countries, we can see that postponement or cancellation are definitely lower, and especially in Finland, with only 16% of the medical therapies that have been interrupted. Internationally, in South America, and this is definitely consistent with the level of anxiety within the country, a very large part of the medical therapies have been cancelled. So 95% in Uruguay, 94% in Ecuador, 89% in Peru. And at the other extreme, only 47% have been cancelled in South Africa, 44% in New Zealand, and only 37% in Australia. So the situation was definitely, it had an impact on every country, we can say, but this this impact was different and not as high depending on the country. And in relation to this interruption of care, patients also expressed the fact that this interruption were extremely detrimental to their well-being, to their health, and to their life for some of them. So for the life, it's not a majority, but still 30% of people living with rare disease in this survey said that this interruption of care were potentially life-threatening. And so I'm just going to go very quickly across these graphs to say that when you have the bigger bubble, let's say it was what concerned the biggest part of the sample. So what we can see in the result is that most of the respondents were concerned by the cancellation of rehabilitation therapies that you can see on the bottom, and that it wasn't life-threatening for them. But for some, and especially those who have seen their surgery or medical therapies cancelled, you have a correlation with the life-threatening aspects. In the survey, we have also seen, and this was one of the positive angles and of this crisis that I'm going to detail, that many patients have experienced online consultation, prescription via email, or online education and training. And 9 in 10 of those who have experienced this remote care found this experience useful. I'm just going to nuance a little bit, and this is what I'm also going to present after this, is that definitely for those for whom this experience of online consultation was new, the satisfaction wasn't as high. And those for whom online consultation were new said that they found it useful at 44% only, as compared to 61%. So this is a first clue that online consultation are of course useful, but they are more adapted in certain circumstances or for certain or under certain conditions. So in the open question, remote care is defined as the most frequent positive experience during the pandemic. And so maybe very often when we think about online consultation, we think about video most of the time, but definitely most of the remote consultation were done by phone. And so also via video conference, but most of them really by phone. And just a little quote from a patient, it turns out that a lot can be done by email. So, and also many patients have been attending webinars, and many of them found it useful. And also some patients use more innovative way to make up for interruption of care or for the cancellation of their consultation, face-to-face consultation. So for example, some send pictures or video to their healthcare professionals. So like this patient in the UK, I sent pictures of infection action around my hearing implant by email to implant center. I received a reply from a consultant within a couple of hours to tell me what antibiotic to get from my GP. I also got a follow-up email to check I had got prescription okay. So this definitely is not the most numerous cases. As you can see, I've only put 1+ as opposed to a remote consultation via phone, but we thought it was interesting to highlight this case. And again, so in the positive in the open question about the positive aspect during the crisis, patients really relate the most appropriate situation for remote care. And what is definitely the most quoted was about like quick question, like you have a very specific and quick question, and it was very useful for them to contact healthcare professional via phone instead of having a face-to-face and more heavy consultation. So for example, this parent in Switzerland says, we always received quick and personal answer to our question by emails, answers that were very tailored to our concerns and did not write pre-printed information. We felt very well looked after. Also questions to relieve anxiety, because obviously during the crisis, and as I showed earlier, the anxiety was very, very high. And one of the purpose of this remote consultation was also to decrease stress and anxiety. So this a woman in France says, at the beginning of confinement, I sent email to the doctors and professors who usually care for my rare disease. They answered my question, my doubts, since I did not call them back. So it has, for many of them also long-term effects on how they have experienced the crisis. Sorry. Many patients reported that the remote care was really helpful to discuss the result of routine medical analysis. So this patient, for example, says, I am currently in a good shape, and it is enough for me to speak to my family doctor by phone to discuss a blood test. Also, many patients reported that they were using this remote consultation to adjust a prescription. So this woman in the UK says, my rheumatologist phoned me to check on my project's progress since discharge from hospital and adjusted my prescription based on this and is arranging for GP to do a new prescription for me. So that's only example, but there was a lot of testimonies in that sense in the survey. The most appropriate situation described by a patient is also using remote consultation for follow-up consultation. So for example, this patient in France says, my semi-annual check for Addison was changed in a telephone consultation instead, which could easily be the case, for example, for every other check in the future. So patients and even those that are not engaged in advocacy activities are saying that this telephone and remote consultation could be included in their routine care to facilitate and relieve the care burden that they experience. They also report that it's been very useful in case of emergency situations, such as injuries, for example. And also, we have many testimonies about using remote consultation as a first check to define whether consultation is necessary. So for example, this patient in Switzerland says, before each planned consultation, there is a telephone conversation. I am called by the hospital about how I am doing, and together we clarify whether consultation on site is necessary. So it was definitely helpful to decrease the risk to go to the hospital, and this is also very easy to imagine how this could be included in routine care. And then we also have, so even if it was the positive question, many patients say that it was a way to compensate for the situation that they were experiencing because of the pandemic, but at the same time, online consultation for more life-changing or more impactful consultation was less suitable. So for example, this female in front says a consultation by phone is better than nothing, but this is not ideal to discuss the idea of a pulmonary transplant. And also, as I said earlier, many patients said that this could be included in their routine care. And the main advantages that they have been quoted was to be able to avoid traveling, to reduce cost, time burden, and also tiredness related to travels. Some patients also, it was less prominent in the open question, but still I thought it was interesting. They said that written communication sometimes enable more precise communication. So this parent in the UK says, we don't usually communicate via emails, and sometimes this is much better because I'm able to write everything down concisely and with a record. So nothing is being missed out as it may on a phone call and leaving messages with secretaries. And also many patients are talking about remote care as being complementary because, for example, they can do the most the administrative part, let's say, by email, and then come only for the actual consultation. Regarding more precisely what was experienced in hospitals for patients who receive care in hospitals, which was approximately 50% of the sample, we see that the level of fear is very high. So half did not go to the hospital because, sorry, excuse me. So half did not go to the hospital because they were fearful of themselves or the person they care for might catch COVID-19. 35 were declared that they were explicitly said not to go to the hospital if they were affected by symptoms other than COVID-19, and 25% report that the hospital or unit that provide care for the rare disease is closed. And so this perception and this fear were definitely different depending on the disease people are affected with. Very often this is linked to diseases that cause immune deficiencies, or for, of course, the most fragile cases. But let's say that in average, 48% did not go to the hospital because they were fearful of they might catch COVID-19, but it's 67% among rare epilepsies, 63% among rare gastrointestinal diseases, 58% among rare pulmonary diseases, and at the extreme opposite, only 31% of people affected by intellectual disability were afraid to catch COVID in the hospital. And some patients, especially in rare pulmonary, those affected by rare pulmonary diseases, reported that their rare disease unit was closed. But again, this is something that varies depending on the disease. And regarding this, so still during the crisis, it came out that many patients went to the hospital or went to consultation anyway. And they, in that case, what really made this possible, or what patient really appreciated, was the additional efforts and kindness from healthcare professionals. So this is definitely what pervades the open question, and patient really praised the additional effort made by health professionals to help them during these difficult times. So, for example, this parent in Spain says they have been very kind and have made sure that their patient has their needs covered at all times. If there has been a problem, they solved it immediately. Masks were distributed to us from the medical center in the town where his home is for travel to the hospital for his hemoglobin infusions. Also, what was, and this is also linked to this first verbatim, but hygienic measures taken by healthcare professionals were highly appreciated. If we remember that fear to go to the hospital were very high, many patients were positively surprised by the level of hygienic measures in the hospitals. And this patient, for example, in Finland says consultation in hospital with mask provided, compulsory hand gel, thermal camera, and clear instruction on allowed and forbidden seats, very reassuring. Also, in hospitals and during consultation, some more innovative measures were in place. So less patient reported that they have experienced it, but still it was interesting to see. So some patients have used the possibility to stay in car parking. So for example, this patient in the UK had her blood test done in her car. And we have also many testimonies of patients who, instead of waiting in the waiting rooms of the hospital or the medical center, waited in their car. And this was seen very positively. And we also we have some testimonies about dedicated hotline in hospitals that were very helpful for patients. In terms of, so some patients went to their consultation, but also some patients received treatment, still received care at home, or had specific flexibility arranged for maintaining their level of care at home. So what is very prominent in the survey is drug delivery. So, for example, this parent says medication delivered at home, the hospital pharmacy sent it through a carrier, thus avoided travel to the hospital. And what is also interesting is that drug delivery most of the time is not, so it's local solidarity, help from the pharmacist, and this patient in Belgium, for example, said that it was the husband of a pharmacist who helped her, and that she was sending her bank transfer. So this is definitely some local solidarity that were really helpful, and that we might consider streamlining or organizing maybe a bit better at higher level. And also patients were very happy when service was still provided at home, and of course with a mask and gel and every measures in place to be able to receive the care without being infected by COVID. Also, what is very clear and what is positive from this crisis is the fact that many patients felt empowered by the fact that they were allowed to, for example, practice some therapy at home themselves. So for many of them, they were using videos and fact sheets sent by professionals. So for example, this woman in Austria says, our speech therapists continuously provide us with exercise materials and video online so that we can continue the therapy as best as we can. This is very difficult to implement, but better than nothing. Direct training with her is unfortunately impossible for an indefinite period. Patients were also, so it's less of them report this directly, but some of them have been using apps also, and generally speaking, they really appreciate the feeling of autonomy, of empowerment linked to all these self-care measures and possibility. And some of them say that it would change the way they see their disease and the care for their disease in the long term. And but definitely this is something that appears as complementary and as something to make up for the absence or of healthcare professionals, but that won't replace healthcare professional intervention, of course. In terms of treatment, more specifically, the survey shows that very few patients have experienced unavailability of treatment. Only 21% have had difficulty to get their treatment, and 7% only had to stop it or to take an alternative. However, we had quite a lot of testimonies about patients who had to pay more when it wasn't available because they had to take another treatment which was more costly. And related to these figures, what we saw is that access to treatment was really facilitated by more flexibility regarding prescription of treatment. So prescription of treatment were sometimes extended, automatically renewed, sometimes automatically. So this patient in Spain, for example, he says the expiration of medicine in the electronic prescription system has been extended. So this was really appreciated by patients. Many prescriptions were done via email and even some by SMS. And it appears that many patients had kind of in prevention store drugs and medicine in the house to be able to face future or the unknown development, of the pandemic. During the crisis, patients felt quite well informed. So 42% felt that they had most of the time the information that they need, and 30% some of the time. But what we can see in the open question is that many of this information is coming from patient organization and patient groups. So that was very, that really pervades the open question, that the helps of patient organization has been crucial during the pandemic. So, for example, patient organizations have been providing information and even medical advice. So, for example, this patient in France says the association has organized a webinar together with its scientific committee. One with a physiotherapist has already taken place and is available on the website. Another one is planned with neurologists, French and Canadian, in the beginning of May. All people affected by their disease were invited to participate and ask questions they might have in advance. So patients also really appreciated psychological support, mutual assistance that they can get through support groups, for example. And sometimes, and quite often actually, we have seen patient organization providing masks and protection. So, for example, this patient in France says mask and hand sanitizer were delivered by the association because they are not available in pharmacies or because they are out of stock. And sometimes also the association even provided the medical intervention or the social support. This was experienced by this woman in Spain. As the sports center and the pool where I am going to do rehabilitation are closed, I have been able to continue with the exercises online with the physio, thanks to the association of patients with my disease. There is also a weekly follow-up by psychologists to find out how we handle the confinement. So definitely help from patient groups in this crisis have been really appreciated by patients. Just want also to mention that I don't mention it here, but many patients quote their patient organization and really thank them in this open material. So I'm just going to skip this one. And yes, last measure. So we hadn't really the time to explore all the social care related results more in depth, but just still what we can see in the survey is that definitely patients had access to more flexibility at work, but that also more impactful measures are lacking. So, for example, around 70% of patients who are employed had the possibility to work from home. 66 had the possibility, were entitled to more flexible working hours, and only 35% have seen the possibility to reduce the number of working hours, and 20% have been allowed to take paid care leaves. So definitely the most impactful measures were less implemented or available for patients, and this is something that we can see from the results is very impactful, because when you cross, so in this survey we also had mental health indicators. So if you cross the possibility to have access to these measures, so patients concretely who are carers who had the possibility to get more flexible working hours, felt definitely less unhappy or depressed, and felt less that they could not overcome their problems. And depending on the indicators and on the measures, so I can't really show you all the results, but there's a reduction from 4 to 10 points on mental health indicators thanks to these measures. So this is yes, this is the end of the presentation. So I just wanted to thank you, to thank all Barometer partners and corporate donors in 2020 who have enabled this survey to be carried out, and that was extremely useful already for the rare disease community. And yes, thank you everyone for your attention. So I guess now we are going to take the question. I see that there are quite a lot in the chat. Yeah.
Thank you very much, Sandra. It was a very comprehensive and interesting presentation. So let's go through the question. Do you have them from Eva, or is it?
Yeah, we had one question already from Stephanie in Sweden. Hi, Stephanie. So she was saying, thank you, great to see this presentation. And could we have the number of participants per country also as a percentage of the whole population?
Yes, definitely we have. So I haven't presented this now, but this is something that is available, definitely, yes. And if she, so we have been in contact with Stephanie, so I can send this data to her. Just one remark, of course, as you guess from the numbers, of course we have more respondents from France because we have more than 1,000, so of course they represent the largest part of a very large part of the sample. But yes, we have these figures and I can send it to you.
Okay, super. And just to remind you all, if you would like to speak, we would love to hear your voices today. You can raise your hand and then speak via the microphone. So you can do that via the bottom of your screen if anybody would like to speak. So lots of people, Sandra, are asking if the presentation will be available afterwards. So,
yes,
yeah.
Definitely. So we will send the presentation to all the webinar participants, and also, as Yann says, so as you probably understood, it's a selection of results and we have a lot of data. And so if you want more details on this aspect or another, or data for your disease, data for your country, that you, of course, you will be also more able to understand and to contextualize yourself, please do not hesitate.
Great. And then we had a question coming from Kirsten. Hi, Kirsten, who's asking, will there be a follow-up of the studies? So she's asking if there's something in a month or in a couple of months, maybe.
Yes. So what we aim is to to put together a report of this data, summarizing the data by the end of July. That it would be available by the end of July. So that's the idea.
Are there any other questions coming through, specific questions about the results? Or anyone that would just like to tell us about how you've used the results already, perhaps in your country? No, I'm not receiving any questions. Very comprehensive presentations on that. That means
It's too much information already.
perhaps everyone else is also experiencing a heat wave as well in Paris.
Maybe could we just repeat during that time, Sandra and Eva, all these results, all the slides will be made available, right, after the webinar?
Yes.
Yes, the slides and a recording of the webinar as well.
There is a recording of the webinar. The slides are completely available to all participants, but also to all members, correct?
Yes.
Yes.
Do you have a couple of questions coming through now? So Maria, hi Maria, who's saying you'd like to have some more detailed info on Hungary. Great. So if you email that email address that I put there, then Sandra can get back to you with the dashboard for that. And sorry, Sandra.
No, I just saw the question from Victoria on the use of the results on virtual care. So we have definitely so the contact with the EU for Health network, and so also with DG Santé. So we presented the first results during the 2 webinars that Yann mentioned, and now we are getting back to them also with this more detailed analysis of the result on online consultation, also in the context of the ERNs, obviously. So this is something that we are going to follow up, not maybe publicly, but we are going, it's a relationship that we maintain to be able to to precise in particular when these online consultations are useful or not to patients and so on, and this discussion that we had already.
Great. Sorry, Stephanie, I missed you raised your hand. Would you like to speak now? I know you've just written, but perhaps you would like to speak as well.
Yes, hi everybody.
Yes,
I just wanted to give you feedback that we are really happy to get the data from the rare barometer study, because we are planning to have our own survey in Sweden, and so this is an amazing point of departure, so to say, and then we can, oh sorry, now I've got noise in the background. We can go into more detail in what we assume may be different for us in Sweden. So just want to say thank you.
Thank you, Stephanie.
There was a comment there as well from Anjan, hi Anjan, saying maybe a summary in future outlook of the results.
Yes, so in this report that we are going to release, we will have a first part summarizing the main findings of the survey, definitely.
And similarly, Anjan, you're saying the survey results should be of interest to the EMA and may result in changes in how clinical trials are run in the future. Yeah. So our colleagues are.
So yes, we have already presented some results to the EMA at the PCWP, for example. So the survey that we did around data sharing and data protection, and we have started to discuss that maybe this could be interesting to present, for example, at the PCWP meeting, for example. Or this is something that we are considering.
Okay. Was anybody else? Would anyone like to raise their hand or speak at all? We've just got lots of people saying thank you for the results. So that's wonderful. Okay.
Okay, I see that there's some debate about the grouping of countries. So yes, this is something that is not always easy, definitely, and especially also for Eastern European countries, the definition is very complicated, whether you take more like a political definition or more geographical definition. So that's a huge debate. To which we are confronted because we are always doing like grouping of countries, and sometimes it's not easy to define and to make everyone agree on the classifications.
But as Yann said, please don't hesitate to send us by email as well.
Yeah.
Okay, wonderful. Yann, did you have any last comments before we finish up? No.
No, really just to thank again all the people who contributed in this audience to the elaboration of the questionnaire and survey, and to the team for the conduction of that. Now, what is important is really to make the best use of it. So there is what you have here in the slides. There is also what Sandra indicated, which you may want to ask for your country, for your disease, for your therapeutic areas, so that you can really customize your advocacy messages. Now we just need to make the most of it, and the most of the time spent by all the respondents. Sandra, you wanted to?
No, that's.
Okay.
I agree. I just wanted to maybe to thank the team and Erwan Bergenot and Jessie Dubief, who have been very quick in analyzing the open question. That was a huge amount of work that will continue, and thank you very much.
Wonderful work. Thank you. And just to mention that there is other surveys and initiatives taken by some European networks or some countries who want to work with their centers of expertise. Some of these surveys are listed on EURORDIS website under the section of European networks. So you will see there is 4 or 5 surveys listed there. So just for you to know if you want to dig more into these other sources of data for your advocacy. With that, I would like to thank very much Eva for organizing this webinar with us. Thank you very much. And Davor, who you don't see, but who is our host and web communication manager. I thank you all. It's rare. We're finishing ahead of time. So make the most of the free time to have a drink, to relax, to take a break. And we wish you a very pleasant evening. Thank you very much again.
Thank you.
Bye, everyone.
Bye-bye.